Lower back pain is the #1 reason people wake up tired and miserable. You've tried stretching, new pillows, even a different mattress, but every morning, the same stiffness. Here is the truth. Your sleeping position might be the cause, not the solution. In the next 10 minutos, I am going to show you exactly how each sleeping position affects your lumbar spine using Somni's transparent anatomy. You will learn the one position that reduces lower back pressure by 60%, plus 2 modifications for when you can sleep any other way. No theory, just visual proof. First, let us see what a healthy lower back looks like during sleep. When you lie on your back with good support, your spine is a natural slight curve called lordozis. It is not flat, and it is not overarched. It is a gentle S-shape. This curve acts as a shock absorber for your vertebrae and discs. But here is the problem. When you sleep on your back with your legs straight and no support under your knees, your lumbar spine arches too much. Look at Somni's lower back that has a deep banana curve. This position pulls your psoas muscle hip flexor and compresses the back of your spinal discs. After 8 hours, the discs swell with fluid that is why you wake up stiff and can barely bend forward. The red area you see here, that is the pressure on your facet joints, the small joints between each vertebra. They get jammed together. Over months and years, this leads to arthritis and chronic pain. A neutral spine like the screen zone means your discs are evenly loaded, your muscles are relaxed, and your joints are open. This is what we want. Let us start with back sleeping, the most common position for lower back pain sufferers. By itself, back sleeping can be good or bad. The difference is one simple thing. What is under your knees? When you lie on your back, place a pillow or rolled up towel under your knees. This flexes your hips slightly and flattens your lower back against the mattress. Look at Somni's spine now neutral, green zone. This position reduces intradiscal pressure by up to 50% compared to lying flat with straight legs. Without knee support, red zone. Your psoas muscle pulls your lumbar spine into extension all night. This is uma cause of morning back stiffness for back sleepers. Now, side sleeping. This is actually the best position for most people with lower back pain if you do it correctly. Look at Somni on his side, legs slightly bent, spine straight, head supported by a low pillow. This position maintains the natural curve of your lumbar spine without forcing it into flexion or extension. But here is the mistake most side sleepers make. The fatal curl. They pull their knees all the way to their chest. This puts your lumbar spine into flexion, a forward bend. Over time, this stretches the ligaments in your lower back and can cause disc bulges. Red zone. Avoid this unless you have severe spinal stenosis, and even then, only with a doctor's advice. The perfect side sleeping position. Keep your knees bent at about a 30-degree angle, not 90. And here is the secret. Place a small, firm pillow between your knees. This keeps your pelvis aligned. Without the pillow, your top leg drops down, twisting your pelvis and creating a rotation in your lower back that adds a fast track to sciatica. The pillow between your knees should be just thick enough to keep your hips stacked vertically. Test it. Lie on your side. Have someone look at your back from behind. Your spine should be a straight line, not a slope. Stomach sleeping. I am going to be directed. This is the worst position for lower back pain. Do not sleep on your stomach if you have lumbar issues. Here is why. When you lie on your stomach, your lower back arches backward extension and your neck is forced to rotate 90 degrees for hours. Your lumbar discs get compressed on the back side. Your facet joints get jammed. And because your center of gravity is off, your pelvis rotates forward. This position can cause or worsen herniated discs, sciatica, and spinal stenosis. If you absolutely cannot stop stomach sleeping, maybe it is the only way you fall asleep. Here is a damage control modification. Place a very thin pillow under your pelvis and lower belly. This lifts your hips slightly and reduces the arch in your lower back. Also, use a very flat pillow or no pillow under your head to minimize neck rotation. But honestly, work on transitioning to side sleeping. It is worth the effort. Let us summarize. That's the worst for lower back pain. Now, here is a 30-second test to know if your sleeping position is hurting you. When you wake up tomorrow morning, Before you get out of bed, notice, do you feel pain immediately, or does it come after you stand up? Immediate pain usually means your position caused muscle strain overnight. Pain after standing often points to disc issues. Use the chart buff to adjust your position tonight, and give it 3 nights. Your body needs time to adapt. Tonight, change one thing. If you wear a back sleeper, add a pillow under your knees. If you wear a side sleeper, add a pillow between your knees. If you wear a stomach sleeper, start practicing side sleeping just 10 minutes before falling asleep. Comment below, which position do you currently sleep in, and which one will you try tonight? Next video, the best stretches for lower back pain you can do in bed while getting up. Somni will show you exactly how. Subscribe to the Somni method and hit the bell so you don't miss it. Your back will thank you tomorrow.